Look at some major bones of the face. We looked at the large bones on the top of the skull. Now we're going to talk about the bones of the face. So we'll start with these two bones right here, very small rectangular bones here and here. Those are the nasal bones. And there is a suture that runs right above that called the frontonasal suture. This opening, called the nasal aperture, has a few things in it as well of importance. We have the perpendicular plate of ethmoid and the vomer. In addition, we have the inferior nasal concha and the middle nasal concha. And this is mirrored on the other side. Middle nasal concha, inferior nasal concha. In the eye, we have a few structures as well of importance. We've got first the lacrimal bone, and directly behind the lacrimal bone we have the ethmoid bone. And on the outside of the eye we have the sphenoid. And the sphenoid goes up this way, but it also continues underneath the skull. So we'll take another look at the sphenoid all the way around when we look at the underside of the skull in a different video. So in the eye socket, you can see two openings. And I'm going to use a pipe cleaner to show you exactly where the opening is. We put the pipe cleaner in. This is the optic canal. And you can see where the pipe cleaner comes out as well on the inside, endocranially. There is an additional opening here that's more like a crack. So if we put our pipe cleaner through there, this is called the superior orbital fissure. And you can see where that comes through endocranially as well. So optic canal, perfect circle, which is here. And then this crack, superior orbital fissure. We've also got this little opening right here and right here, and that is known as the infraorbital foramen, or those are the infraorbital foramina. So just one would be foramen. This entire bone here and here would be the maxilla. And then as we talked about previously, this entire bone represents the mandible. Right above the eye sockets, we have a supraorbital notch. Now, some skulls have supraorbital foramen, which are perfect circles, but these are notches. They are not fully closed. So supraorbital notch or supraorbital foramen or foramen. The very tip of the mandible is called the mental protuberance. And then we have the mental foramen. And this is the zygomatic bone, what you would call your cheekbone, which would of course be on both sides.